Well, Nancy Pelosi has the preliminary score from the House version of the health care bill. Again, no details yet, but maybe these guys have heard something.
Democratic Representative Anthony Weiner from New York here in our studio. We're pleased to say. And Republican Phil Rowe from Tennessee join us now from the Capitol. Congressman Weiner, first to you, and congratulations on your engagement, first of all. You're disappointing a lot of eligible young ladies out there. Question is, you have talked a lot about how efficient a government option would be, the so-called public option. I know you have problems with that term. But if it's so efficient, why do we need any private insurance companies?
I don't think we do. Frankly, if you have a choice between giving 30% in opens and profit or 3 and 4%, I don't think you do. The same way you don't have a private fire department or very often a private sanitation department or a private water department. You don't need it. In fact, we're putting hundreds of billions of dollars each year that we don't need to. Look, we have an experiment going on in this country for the last 44 years. Medicare, low overhead, 3.5% versus health insurance companies, which are taking about 25% and not offering us anything back for it. To me, it's a pretty easy question. If you want to save some money, I know where you look.
Representative Rowe, let's get to the news today, and that is the CBO score, and tell us what you're hearing about that and your thoughts.
Well, just congratulations, Congressman Weiner, also on your engagement.
Thanks.
One of the things that he left out, though, was when these estimates come out, they're strictly estimates. And Medicare in 1965 was a $4 billion program. It was estimated to be a $12 billion program by 1990. It was over $90 billion. Today it's $428 billion. So you're looking at enormous misses in the estimates. And I would argue that we tried the public option in Tennessee, and if we have time, I'd love to go into it. It certainly didn't control costs, and the public option that we had didn't pay the cost for the providers either.
All right. Well, Congressman Weiner, you are much closer to the decision-making powers now that happen to be inside the Beltway. When are we going to get these CBO figures?
Well, it's going to be soon. Frankly, I can tell you what the numbers will be. They'll be south of $900 billion. It'll be completely paid for in the bill. That's really not much of the mystery. The real mystery is how much are we going to have downward pressure on prices? And the public option is almost the be-all and end-all of that conversation. Because the insurance companies came out a couple of weeks ago, you guys covered it extensively, and said that if we don't change anything, rates are going to go up 111%. That's why
I got to press you, though, specifically. I mean, timing is important here, particularly for Democrats. When are we going to see these CBO figures?
Probably before Thanksgiving, this will all be said and done.
Before Thanksgiving? That's a long
way.
Well,
at first I was hearing on these shows, oh, you're doing it too fast, now it's too slow. We can't win with you guys.
You know what? Touche. Representative Rowe, if those numbers were correct and the private insurers, without any involvement, we'd see another jump. Hold on a second. We've got some breaking news. We have Shivani Joshi with the Yahoo numbers. So stand by to both of our congressmen. Shivani?
Yep, we have better than expected numbers coming out of Yahoo. Earnings per share of 15 cents per share. That's almost double what the street was looking for on revenues of $1.58 billion. Again, ahead of what the street was projecting. And trying to get Yahoo quote for you. And it looks like it is trading higher on that news. I'll bring you more details a little bit later on in the show, but a beat on both levels for Yahoo in the third quarter.
Okay, Carol Bartz showing some muscle there. Thank you. Let's go back to our discussion. Representative Rowe, I'll finish the question. If we left everything as it is and we don't see any reform, we would see health insurance rates jump more than 100%, according to Representative Weiner. Listen, people are living that life. They have seen insurance prices go up and up and up. Doesn't something need to be done? And suddenly it's the insurance companies that are really being held up as sort of this woe is me situation.
Let me give you an example, and certainly no one suggested not to do anything. A couple of simple things we could do to make insurance more competitive is eliminate state lines. You can buy your homeowners, your car, life insurance across state boundaries and have true competition. What happened in Tennessee, we had this very argument 15 years ago in 1993, and we're not a very wealthy state. We tried to cover, and we got up to almost 96% of our citizens in Tennessee with a plan called TennCare. It was a Medicare waiver. We had 7 or 8 companies compete for the Medicaid business or the TennCare business. What happened was, in 1993, we spent about $2.6 billion on government-run medicine, Medicaid, health care. In 10 budget years, it had gone up to $7.6 billion. And what happened was we had about 45% of the people who got on TennCare had private insurance and dropped it. The real caveat here is that The TennCare, the Medicaid plan, paid less than 60% or 60 cents of a dollar. In other words, you didn't pay the cost of providing the care. And so what our Democratic governor did, along with the legislatures, they had to cut the rolls because it was about to break the state government budget. That is exactly what will happen. My concern, and with this
all right, well,
plan,
let me just get Congressman
Weiner would like.
All right, let me get Congressman Weiner in. Forgive me, Congressman, but Congressman Weiner,
Canada and England, anywhere this has been
Congressman Weiner, it is absolutely true that estimates in the past of rates going up, just as Liz said, insurance rates have gone up. You look at what's happened to Medicaid and Medicare, far beyond any of the CBO estimates. That were, how can you guarantee that the same thing won't happen with this new public option?
There's two different questions. One, my colleague is absolutely right. Medicaid expenses have gone through the roof because more and more people are uninsured. 17,000 people every day
I'm
lose
talking
their health
about
insurance.
waste and
Hold
fraud.
on.
Waste and fraud.
Let me also
year.
address your question.
That's the big money.
The cost of the growth in Medicare is actually less than it is in private insurance, despite the fact they're covering old and sick people. The fact is, when health insurance companies get a $1,000 increase to their cost, they charge us $1,050.
We talked about insurance companies. I'm talking about Medicaid and Medicare. What about the waste and fraud? How can you keep it out of this new system?
That is why we are going to get $411 billion of savings in Medicare. One of the things we're going to do, we're going to require people to compete. But to hear my colleague criticize government plans, next year he's going to be 65. 150 members of Congress take Medicare and don't complain about government options. Why not when you're 63 or 62 or 52? That's the question that we have.
Okay, that has to be the last word. We thank both of you, Representative Rowe and Representative
And the
Weiner.
bride will be?
That's for another announcement on the show.
Congressman, thank you very much.
And we'll bring you both back as this conversation continues.